Good morning, students. Today I'll be dealing with the records and reports in nursing service departments. What are the records and reports in nursing service departments? Records are the permanent file of something. Records are the permanent file of something. Something written for proof. Records are the something written for proof. Permanent form are the records. Records are the evidence or proof. Next we will see the definition of records. Records are legalized documents. Legalized means related to law. Records are the legalized documents that cover the patient detail in hospital. Patient details documented by the doctors, nurses and other healthcare team members in a confidential manner. Records are the legalized documents that cover the patient details documented by the doctors, nurses and other healthcare team members in a confidential manner. Confidential manner means not telling to others. First definition of records. Then second definition, records are the administrative devices used to collect and classify the information. Records are the administrator's tool used to collect and classify all the information. In administrative setup, the records are used to collect and classify all the information related to the organization, related to the patient, related to the structure, all the information and classify the information. So the records. Next we will see the purposes of records. What are the purposes of records? First one is it provides documentation of the services that have been rendered. For example, if we are giving care to the patient, any care, that will document. So record is used for the documentation of services that have been rendered. That means give. Second one is to provide the practitioners with the data required for the professional services. To provide the practitioners means workers with the data required for professional service. What all data is required for the professional service, that all written in the record. Then act as a tools of communication between healthcare team members, family and other development personnel. Records are act as a tool of communication. Tool of communication means if patient and family, the family will tell about the patient, that all we will record. Tools of communication between healthcare team members, family and other development personnel. A record indicates plans for future. Record is used for the planning of future. It provides baseline data for estimating long-term changes related to services. Record is used for estimating any changes. Then health record shows the health problems in the family and other factors that affect the health. Health record is the health problems in the family and other factors related to health. Next we will see the what are the records used in hospital. What all records used in the hospitals. First one is admission record. In admission record, we all have seen admission record In admission record, what all things we will write? The admission number, age, sex, address, date of admission, all things will include in the admission record. Then medical history of the patient. Medical history, in medical history book, from the admission to the discharge, all things will written. Then physical examination, after examining the patient, every systems that will written in a book, that is physical examination. Then laboratory and radiology records. Then patient records, patient case sheet or chart. Then impression and diagnosis, patient impression and diagnosis. Then operative procedures, in operation theatre operative procedures, there is a records. Then nursing notes, day care, daily day report and night report, that is nursing notes. Then consultations, about the consultation. For example, if one patient is many diseases, they will write the consultation. For the other doctors, consultation. Then discharge information means the reason for hospitalization, present state after discharge, for then treatment, what all treatment given, then follow up, all things will include in the discharge information. Then records and reports of the CNO office, what all records and reports used in CNO office. CNO means Chief Nursing Officer. Matter. First one is allocation register. Allocation register means it's a computerized work. It refers to the practice of assigning variables to registers as well as handling transfer of data into and out of registers. It refers to the practice of assigning variables. Variables means variables stored in the CPU. Refers the practice of assigning variables to registers as well as handling the transfer of data into and out of the registers. Next one is the leave account register. In ward leave, about the in CNO office, staffs leave, all the workers leave. Then deployment register. What is deployment register? Deployment register means assigning people to serve in various locations. The CNO will write all the people to serve in various locations. That is deployment register. Then cumulative record, Chief Nursing Office communication register. Then roll call book, evening and night. Roll call book, you know. Then daily report of the hospital, which include statistics, daily statistics of the patient, number of patient. Then OPD statistics, number of OP patients. Then emergency ward statistics, number of patients in emergency ward. Then labor room. Then critical or private ward, number of patients came in critical ward or private ward. Then VIP patient report. Next is the institutional records and reports. What are the institutional records and reports? The type of records usually kept in college institution, College of Nursing, may be divided into three. The types of records usually kept in College of Nursing may be divided into three: students record,